Hello everyone, I'm Dr. PK. You've gone keto, your energy is up, your weight is down, your triglycerides look great, your HDL looks great, but then your LDL comes back at 200 or even higher. So now the big question is, should you panic? The answer is not blindly, but definitely not casually either. In some people, especially lean, active people on a very low-carb diet, the body shifts heavily toward using fat as fuel. A proposed explanation called the Lipid Energy Model suggests that when carb intake is very low, the body packages and moves more fat through the bloodstream to supply energy. In that setting, triglycerides may fall, HDL may rise, and LDL cholesterol can sometimes rise dramatically too. This pattern has been described in a subgroup often called lean mass hyperresponders, where LDL may reach 200 or more while triglycerides stay low and HDL stays high. Researchers have formally described this phenotype in recent literature, but it remains an area of active debate, not settled doctrine. Here is the nuance many people miss. Low triglycerides and high HDL are often encouraging metabolic signs, but they do not automatically erase the concern of very high LDL or a high number of atherogenic particles. Major lipid guidance still treats ApoB-containing particles as the particles that matter most for plaque formation. ApoB is increasingly valued because it reflects the total number of cholesterol-carrying particles that can enter the artery wall, not just the amount of cholesterol inside them. So when is high LDL on keto more concerning? Here are the red flags. Number 1, your ApoB is high. That suggests a high number of atherogenic particles. Number 2, your non-HDL cholesterol is high, especially if it stays persistently elevated. Number 3, you have a strong family history of early heart disease. Number 4, your lipoprotein A or LPA is elevated. Number 5, you also have diabetes, smoking, high blood pressure, chronic inflammation, or known plaque. And number 6, imaging already shows you are not starting from zero. The National Lipid Association and other expert guidance continue to recommend that persistently elevated LDL-related markers, especially ApoB, non-HDL-C, or LDL particle measures, should not be brushed off just because someone feels well metabolically. If your LDL shoots up on keto, do not stop at a basic lipid panel. Ask your doctor whether you need advanced risk assessment. The most useful next tests often include ApoB. This tells us particle number more directly. LPA? This is a genetically influenced risk factor that can quietly increase risk. An NMR lipoprofile or similar particle test. This can estimate LDL particle number, which may add context when standard cholesterol values do not tell the full story. Advanced lipoprotein testing can help in selected patients, although not every guideline requires it routinely. CAC Score or coronary artery calcium score. This can help detect calcified plaque and refine risk, especially in adults where treatment decisions are uncertain. Current cardiovascular guidance gives CAC an important role in risk stratification, and very high CAC strongly supports aggressive LDL lowering. CIMT may sometimes be discussed, but in most modern prevention practice, CAC generally carries more guideline weight than CIMT for risk refinement. That is an important distinction. So here is the bottom line. A high LDL on keto may, in some people, reflect a real metabolic adaptation to fat-based fuel transport. But that does not automatically prove it is harmless. The smartest move is not panic. And it is not denial either. It is context. Look at ApoB, look at LPA, look at particle number, and in the right person, look at coronary calcium. Because the real question is not just what is my LDL? The real question is what is my actual artery risk? If you want practical evidence-based explanations on cholesterol, keto, ApoB, and heart risk, subscribe to DrPKlyfe. Because in medicine, the goal is not fear, the goal is clarity.